Hello. Thank you very much for this wonderful opportunity that you have given me to talk about infectious diseases in the era of climate change and planetary health. And I would like to start my talk by defining what planetary health is. You might be wondering, what is this new concept? And in planetary health, we always say we now have two patients, not just the people, but also the planet, because many of the challenges that we are facing today are really at their intersection. We know that the health of people and the health of the planet are deeply interconnected and, in fact, inseparable. And one of the main challenges at the nexus of our health and our planet's health is climate change and how it affects human health. As you can see in this diagram, climate change affects human health in many different ways. There are multiple arrows, many different boxes. I will not belabor you with the details, but climate change is going to affect every arena of human health, of public health. And on your right, you will see that there is really no single disease group that is going to be immune to the impacts of climate change. You name it. Infectious diseases, of course, we're going to talk about it in this presentation. Non-communicable diseases, our nutritional status is expected to be reversed if climate change will continue. And even the health of our brains and our hearts, mental and emotional health, will also be influenced by the changing climate. And we in the Philippines live in what we call a climate hotspot. The entire Southeast Asian region is a climate hotspot. And in this map, the redder the country is, the higher the vulnerability of the country is to climate change. And unfortunately, our beloved Philippines is the reddest of them all. And it just reminds us that we need to act on climate change if we are to protect the health of our fellow Filipinos. And how does climate change affect the Philippines and our health? Of course, we're more familiar with the extreme events such as typhoons and intense flooding. Over the past 4 years, we have seen and experienced the confluence between the COVID crisis on one hand and the climate crisis on the other. So imagine you're a poor Filipino living along the coastlines or along the corridor of the typhoon, and you are confronted with the dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus, only for the roof of my house to be blown away by the strong wind? Or on the other hand, do I move to these cramped evacuation centers, safe from extreme weather events? But as you can see in this photo, there is no physical or social distancing to begin with in these temporary shelters. And so there's a very high chance that you will be contracting not only SARS-CoV-2, but also other infectious diseases. But also, apart from the extreme events, we also need to remember that climate change also affects our communities, our societies, through what we call slow onset events. They're more subtle, more insidious, but nonetheless consequential for human health, for our entire society. And one of these slow onset events is sea level rise. The Philippines, as an archipelagic country of more than 7,000 islands, is already facing some of the fastest rates of sea level rise in the world, around 5 times that of the global average. And when the level of the sea continues to rise, seawater begins to intrude into freshwater systems, people start drinking, consuming water that is high in salt, and that could lead to a wide array of public health impacts, for example, kidney stones or preeclampsia in among pregnant mothers. And of course, if the sea level continues to even further inundate or flood our coastlines, then there is a very high chance that entire communities will need to be forcibly displaced and relocated. In fact, even our capital city, Manila, is at risk of being underwater if climate change is not going to be averted. But apart from the wet effects, we also need to remember, and we're already experiencing this as well, that we expect that the whole world, but also Asia Pacific and including the Philippines, will continue to become a much hotter place to live in. Over the past several years, every time we're in summertime, we have noticed that the heat indices that are reported, for example, by Pag-asa, are already hitting unprecedented values, never been is seen or experienced in the modern history of our country. And so how can we also prepare for intense heat, how to enhance the capacity of our public health systems to make sure that people are protected from the myriad health impacts of extreme heat. And of course, and we're going to talk more about this in the coming slides, the planet's health is essential to prevent infectious diseases. Whether it's through typhoons and flooding or heat or sea level rise, all of these hazards will definitely shape the transmission, the profile of infectious diseases, not only in our country but worldwide. And research is now revealing that almost every or every infectious disease is going to be influenced by climate change because, at the end of the day, they are, living organisms, and they're susceptible to, environmental conditions. Even viruses are susceptible to the changing environment. And therefore, our community, of public health, of medicine, the infectious disease prevention and control community will need to brace itself for potential, more outbreaks of infectious diseases of all kinds as we confront the climate crisis. And in fact, according to studies, all ways by which infectious diseases are being transmitted will be or already are influenced by climate change. But as you can see there, the most the transmission mode that is most affected is through vector-borne transmission, with our mosquitoes, of course. But also waterborne diseases are also at high risk of being exacerbated, again, as a result of climate change. And, as you can see here, all the other pathways or modes of transmission are also being affected. And that's because, and I'll not belabor you with the details of this diagram, but as you can see here, climate change is going to alter the conditions for, what we all know as the epidemiological triad. It affects the pathogen, it affects the environment around us, water, soil quality, the social conditions, and of course the hosts, people or animals that bear these pathogens. And the changes are twofold. It will, climate change will alter the natural environment, as we already alluded to, but also it will alter and modify the social environment. People, moving to and being concentrated in certain places to protect themselves from climate impacts through migration. All of these will allow not only the emergence of new infectious diseases, but also the resurgence of the more familiar infectious diseases. Many of them we're still trying to control, to prevent, to eliminate, and to eradicate. And building on that, idea that it affects the epidemiological triad, climate change is going to drive more emergence of pathogens, both old and new, but it will also alter how the pathogens are being spread in a particular locale or population, both how it's transmitted, but also the susceptibility of animals and people to these infectious diseases, because climate change is also going to alter our physiology. And then because, diseases, infectious diseases do not anymore respect national borders, climate change is a planetary issue that is not confined in a particular location, then it also drives the global spread of these infectious diseases. We've seen that in COVID. We'll see that more in other pathogens moving forward. So I'll not go into the details, but basically that's how climate change really will change or alter the infectious disease profile of the world. But this is an emerging area of research. And as you can see in this paper, there are certain, you know, pathogens and vectors and modes of transmission that are more studied than the others. Dengue and malaria, for example, are favorites among the infectious disease research community when it comes to the nexus of climate change and infectious disease. But there are also other diseases that are likely or are already being affected by climate change. However, they are being less studied. And as you can see here, especially in low and middle income countries where many of these infectious diseases, tropical diseases, remain to be prevalent. And so I hope this is an encouragement to our community that especially those who are inclined to do more research, to really focus on, investigate, give more attention to this emerging area, the intersection of climate change and infectious disease. But there are some initial studies that are being and have already been conducted in the Philippines, for example, specifically on diarrheal disease. Here you will see that there is a strong association between increasing temperature and increase in diarrheal incidence. And as you can see in both bar graphs, there is a J-shaped pattern. The higher the temperatures, the higher the mortality, but also hospitalization as a result of diarrheal disease. And this is just for the national capital region alone. And then another study revealed that, a while ago, it's based on historical data, but now how about the future situation moving forward? What is the projection when it comes to the relationship between temperature and hospitalization due to enteric infections? And as you can see, this is a bit complicated, series of histograms, but you will see that the higher the temperature is, the higher the mortality result and hospital admissions resulting from these infections. So we really need to prepare for this, but also most importantly, we need to do everything we can to prevent these projections from being realized. But also for dengue. So a while ago, it's diarrheal disease. Now for dengue, which I already mentioned a few times, what we're seeing is that dengue is now, moving. It's now existing in places where they've never been seen or encountered before, especially, even the more temperate regions like Europe and some parts of North America. But also in tropical areas, dengue is spreading out, more outbreaks are happening, they're becoming more frequent, and they're even not anymore following the usual seasonal patterns. We're already seeing that here in the Philippines. And so, the challenge now is how to, address dengue in a new way that considers climate change and all other environmental and social factors that are important for in the 21st century. And then there are infectious diseases that have less direct connection with climate change, but are going to be affected nonetheless. And in fact, in this article, as you can see, there's a question: is tuberculosis being left out of the climate and health debate? We know the Philippines is still trying to control and to reduce the burden of TB, which is an age-old disease affecting especially the poor. And we know that climate change increases the vulnerability of the poor, people living in very high, in highly dense areas where TB can be easily transmitted. And so the links are indirect. But when we start thinking about a better approach to TB control, we now need to consider the changing climate as well. And even for HIV/AIDS, yeah, this is a paper that I actually co-wrote a few years ago. And while there is still no strong or direct evidence linking climate change and the virus, how climate change and its many different factors and pathways influence the viral behavior, for example, there are many indirect pathways that link climate change and HIV/AIDS, especially when it comes to the social determinants and environmental determinants of people living with HIV/AIDS or people who are vulnerable to acquiring HIV, and also how climate change is going to affect the continuity of HIV services in the country, especially for a country with many different islands frequented by typhoons, flooding, and now also facing the slow onset events. So we need to start thinking about how to apply a climate lens also in our approach to HIV, AIDS, and that this is already being discussed even at the global level. And then, of course, we already alluded to COVID-19. And unfortunately, COVID-19 will not be the last pandemic of its kind, especially because of climate change. This is a study that was published 2 years ago. And as you can see, that climate change in itself can drive the next pandemic. Among the, the other drivers of pandemic emergence, of zoonotic spillovers. And the other key message here is that the pinker or the more purple the region is, the higher the chance that the next COVID-19 will be emerging, for example, in the forests of the Philippines or Indonesia or China. And, climate change can further accelerate that, again, zoonotic spillover, the jumping of pathogens from animals to other animals to eventually human beings. And so, again, we need to address climate change if we want to prevent the next pandemic. And of course, we know that based on studies, and this is certainly a gross underestimate, that we only needed 2% of what we spent during the pandemic, or even way less than that, in order to prevent the next one. Again, prevention is better than cure. And we know that if we want to prevent the next pandemic, we need to address the environmental drivers of zoonotic spillovers. That includes climate change. But this is the situation. Um, Scientists are already saying that we only have until 2027 to stabilize the global climate system, to stop climate change from worsening, to reduce the carbon emissions that we are, producing that further destabilize the global climate system. And unfortunately, the medical community continues to operate as if the global climate system is doing okay. But again, I laud you for centering climate and health in your conference. And worse, during the pandemic, we have not included climate change in the agenda. We've even created new forms of pollution. Now you have gloves and masks and other types of PPEs floating in our seas and in our lakes and in our rivers. And our health facilities and our health systems we're not ready for the pandemic. We are surely not ready for climate change as well. They say that COVID-19 is a dress rehearsal for the climate emergency. And so the question that we should be answering is, are we ready to build health systems that consider the climate? Are we ready to prepare the next generation of health professionals, infectious disease specialists included, who care not just for the health of people, but also for the health of the planet? And can we now start reorienting towards planetary health values? I already defined planetary health at the start of this talk. And so what can we do? First, we need to reduce the emissions coming from our sector, what we call greenhouse gases. I will not go into the details. As you can see, there are three main buckets of sources of carbon and other greenhouse gases in healthcare, from the energy that we use, to the anesthetics that we use in the operating theater, to the food that we serve to our patients and staff, to the medical devices, equipment, and pharmaceuticals that we purchase, to all the way to waste disposal. All of these are emitting carbon, greenhouse gases to the atmosphere. We cannot be part of the climate crime if we want to protect the health of our patients and our communities. And so this is just an example of what we can do. One of my hobbies whenever I go around the Philippines is to take photos of health facilities and hospitals that are already embracing solar power, which is one of the many solutions for the greening of the health sector. And then here you will also see that we need our health systems to be resilient, to be ready, to be prepared, to be adaptive. We don't want a health system that collapses when climate change and its effects do occur, but we want a health system that recovers and recovers better than before, and even transforms amid the climate crisis. And so we know that the Philippines is a very decentralized health system. Our local health systems, our municipal health systems are at the front lines of the climate crisis. And so we need to strengthen our local health systems, our local health workers, our rural health units to be ready to address these emerging impacts. We need to start using what we call climate services, climate data, to project future disease situation or profile, as I've shown to you a while ago with the diarrhea study. And we need to do this for as many infectious diseases as we can. And this requires a transdisciplinary approach between health people and climate people, bringing together their data sets. We need to address the upstream drivers of emerging infectious diseases. And we already talked about the climate, but we also need to talk about deforestation and land use and wildlife trade and even agriculture, because many of our domesticated animals also harbor the pathogens that are sensitive to climate change. We need to start thinking about our therapeutics and our preventive measures, for example, our antibiotics, but also, and very importantly, our vaccines. Vaccine innovation is a critical response to the climate crisis. We need continuous discovery and manufacturing and dissemination of vaccines for climate-sensitive diseases, but we also need to make sure that vaccine production, distribution, and consumption is not harming the planet because of our use of plastic and fossil fuel energy and all these other sources of greenhouse gases. And if we really want to protect the health of both people and planet, if we want to, protect everyone from climate-sensitive infectious diseases, we need to work with other sectors. Cross-sectoral action is vital. We need to work with urban planners and people from the energy sector, the transport sector, the food and agricultural sector, because again, all these sectors are contributing to the climate crisis. So for example, we need to start rethinking our food. I just want to introduce to you what we call the planetary health diet. As you will see the plate is half of it is comprised of greens, vegetables, fruits, and less than a quarter for whole grains, and a very small portion is dedicated to meat. And if you're going to translate this into a week-long diet, it means you will be only eating meat in one meal out of the 21 meals, 7 days, 3 meals in a day. And reducing our meat consumption is what we call a quadruple win for planetary health. It's a nexus solution. And when we say it's a nexus solution, it addresses multiple issues at once. It decreases non-communicable diseases. We know that increased meat consumption can lead to colorectal cancer, among others. It reduces carbon emissions because the meat sector is one of the leading emitters of carbon, of greenhouse gases. It lowers antimicrobial resistance risk because, our poultry and meat industry, they are pumping antibiotics to these domesticated animals as if they're vitamins. And so we need to rationalize the use of antibiotics, not only for human medicine, but also for the animal sector. And of course, it prevents zoonosis because we already mentioned they also are hosts to many of these climate-sensitive infections. And we also need to prepare the next generation, and planetary health education is the way to do it. We need to embed climate change in the education of our future health professionals, physicians, laboratory technicians, nurses, and many other colleagues in the health sector. And so to conclude, the climate crisis is a health crisis. And in this day and age, we cannot anymore ignore the fact that climate change is affecting our health. We need to start acting on it. And I hope that this presentation provided you not only with the diagnosis of our health and of the planet's health, but also presented to you the management, the solutions, the response, the planetary health approach in order for us to advance the health of both people and the planet. Thank you very much.